So the core canister or the whole core canister, I want to talk to you a little bit about what we as women's health or pelvic health physiotherapists mean by the whole core. So you may have been to exercise classes before, or maybe to something like Pilates, and heard them speak a lot about the core. So sometimes it depends on the teacher, or sometimes the setting as to what people mean by the core. And often in these kind of settings, particularly in kind of exercise classes, maybe the gym, when they're talking about the core, they often are just referring to the abdominal wall. In another video, we'll cover a bit more about the abdominal wall and the different layers of muscles. But as women's health physios, we often refer to the whole core, which, if you kind of think about a house, is like the roof, the sides of the house, and the foundations. So when we talk about the roof, we refer or are referring to the diaphragm, which is a large dome-like muscle which sits underneath your kind of like chest area, and is protected by your ribs, kind of underneath the ribs. And then the sides of the house, if you can imagine, they are your abdominal wall and back muscles. And then the foundations or the floor is your pelvic floor muscles. And they are generally the least talked about group of muscles or forgotten about muscles, often in lots of different types of exercise classes. There's certainly more in the last 5-10 year classes like postnatal classes, or women's classes that are maybe more talking about this area now, which is so important. So it's really key when especially it comes to pelvic rehab about thinking the floor of your core and whole core.